Well, good afternoon and welcome to September. This is the Public Health District report for September the 1st. Annette Rodriguez will come and give us the statistics on the COVID pandemic here in the city and county, what's happening up to through the day. And then Dr. Bird will come and give his report following Annette. I'm starting the press conference, getting it going. Mr. Zanoni is upstairs on a conference call at 5 o'clock with the TCEQ and other agencies that are involved, the Coast Guard and others that are monitoring that offshore gas well. And so I'll excuse myself once we get the briefing going to go up there and join that conference call. But at this point, we've not had any reports that through air monitoring that there's any problem. I guess fortunately for us, the South Texas wind is blowing pretty good today and out of the southeast, and so we feel comfortable that at this point there's no issue, but that's one of the things that will be discussed at this 5 o'clock conference call that I'm going to go to, and that's where Mr. Zanoni is at this time. So Annette's going to be the provider of the COVID information today, and then following her, like I said, Dr. Bird. But to just be assured that we're paying attention to it, and we're paying attention also to the offshore well, and we will keep you advised as to any information that needs to be shared with the public to reassure you that we're looking after everybody's best interest in their health and their safety. So at this point, I'd like to call on Annette Rodriguez to come up and begin her presentation. And I'm going to excuse myself to go up to that conference call, and then Dr. Bird will join WebEx and give us a lot of current vital information. I've not seen the numbers now, but I know in the last few days, as we see them begin to come in, it looks very promising. We're continuing to move down, but don't get overconfident. Just stay on the verge of excited that we're making progress on a daily basis. And at some point, maybe the month of September, we'll get to that zero line. So we're looking forward to that, but continue to pay attention to your habits that you're doing. Continue to wash your hands, wear your mask, stay away from sick people if you're well, and if you're sick, please stay away from well people and healthy people. And the other thing, the judge and the city announced yesterday with the Labor Day weekend coming up this weekend, that the beaches will be open unless there's some change as a result of the offshore well. But I don't anticipate that, but we will continue to monitor and keep the public well informed as to the impact that may or may not have on us through the next few days. So at this time, I'd like to call on Ms. Rodriguez to come up and start making her presentation.
El día de hoy la información será provista por la directora del Departamento de Salud, Annette Rodríguez, ya que el alcalde está ocupado con TCEQ en cuanto a la fuga de gas en el Golfo de México, la cual aparentemente no afecta la salud de nuestra área, gracias a los vientos del sureste. Mientras tanto, le pido continúe tomando todas las medidas de salubridad. Ayer también le anunciamos que las playas van a continuar abiertas hasta próximo aviso.
So good afternoon. Annette Rodriguez, Public Health Director. So I'm going to start today with the statistics for Nueces County on COVID-19 cases. So the first slide you're going to see is that as of today, we had 69 COVID-19 cases. And so yesterday, 55, and then the weekend, we had 37 and 29. And so the weekend always seems to have lower numbers, but The really important part here is that we're in the double digits now, which is great news, and we need to get into the single digits now. So this is really, really promising. The other thing is the trend. We see 172, 91, 93, 94, and then the numbers come down lower on the weekend, and then 55 and 69, we need to see them coming back down as well. Next slide. So this slide basically shows the same thing, except in addition, it shows that when the state sends us additional numbers that they've been sent directly from the laboratories, so we call that a data dump. And so these numbers are dispersed in the correct days that the lab was actually taken for these individuals. So you see the yellow bars next to the 98, you see the 46, those are the two numbers combined as the actual number. And you see that all the way until August 28th. So, which means that we haven't gotten additional numbers for August 30th, the 31st, or September 1st. Next slide. These are the daily cases instead of the bar, the yellow bar being beside it. It's on top, and so you see, kind of the pattern and trend. You see the peak that looks like right around July 15th, somewhere in that time frame, and then coming down, and we need for it to continue to come down, especially before flu season. Next slide. This is the donut shape graph, and it basically shows some good news that we have 12,175 people recovered from COVID-19. These are all potential convalescent plasma donors, and we have 6,454 active cases of COVID-19. The deaths to date are 363. So, next slide. These are the hospitalizations, and the hospitalizations also are coming down. If you look at the left side of the graph, you see 224, and if you look at the right side, you see 143 hospitalizations. So that's a really good number because even at 143, you're still, stretching your resources for COVID-19 patients for hospitalizations. Next slide. This is the ICU patients, and so it looks kind of like it's plateauing, but it's actually still decreasing, which is a really good thing. So from 74 to 70 to 68 to 63 to 64, so right in that area of number of COVID-19 patients that are still in the ICU. Next slide. These are the deaths by actual deaths that we receive at the health district, and we're at 10 more today than we were yesterday. So now we're at 363 deaths as of today. Next slide. And the final slide gives you a 7-day average of the COVID-19 cases. And again, this is a really good depiction of the peak and how it's coming down. You can see the red depicting how that's coming down. So for the last week, the 7-day average has been 67 cases per day this week. So seeing double digits, and again, we want to go down into the single digits so we can get through flu season. So, and that concludes the numbers for today. So, but what I want to talk about now is first, I want to extend my sincerest condolences to the family and friends of the deceased, of the 10 individuals that lost their fight against COVID-19 today. So I also wanted to inform the community that we did have a drive-through this morning, and we had 17 individuals that were tested, and 7 tested positive, which gives a positivity rate of 41% for that specific drive-through this morning. It's just still high. But that's just for that specific drive-through, and the numbers are fairly low. So today I wanted to give examples. I think that going into the flu season, I think it's going to be very important that we actually know how we contract COVID-19. So these are examples of how COVID-19 is transmitted. So for these examples, I'm going to pretend like I'm the sick person. So I'm sick. I remove my mask to cough, and I use my hand to cover my mouth. Then I come up to you and I shake your hand with my infected hand. You go and you rub your eyes, nose, and mouth. or you move your contact because it's hurting you, or you remove something from your teeth, or you bite your nails, now you could pick up COVID-19. I'm sick. I cough, but my mask isn't fitted properly. So airborne particles are coming out, and you're close enough to me to actually get some of those particles on your eyes, nose, and mouth. And so now you get sick. I'm sick. I sneeze, and I move my mask off to the side because I really need to move my mask. I just feel like I can't sneeze with my mask on. And you're close by, and you have a mask on, but your mask isn't being worn properly. You have it right below your nose. And so now I've infected you with COVID-19. I'm sick. I'm at the bank, and I use the electronic pen that's just hanging there because I need to sign. And then the person behind me comes, and they use the electronic pen. They're not sick at this point. They've just touched a pen that I've touched with my dirty hands. And now they get back into their car, and they rub their nose without realizing, or they pick up a little snack that they were eating in their car, and they put it in their mouth. Now they get sick. I'm just a little sick. I go to school, and I share my Gatorade with my best friend. I've just shared my germs, my COVID-19 germs, with them as well. I'm a little sick. I don't feel really bad today, so I go to school. It feels like it's just allergies, and I share my bag of chips with my buddies. They touch the bag of chips because people ask me, well, did they get it from the chips? No, they didn't get it from the chips. My hands are dirty. They're infected. I'm touching the bag. I hand you the bag to share with you, and you touch the bag. You still don't get COVID-19 that way, but your hands are dirty. And so if you use those hands to touch your eyes, nose, and mouth with those dirty hands without washing them first, you pick up COVID-19. I'm sick, but I really like your mask. So you let me try your mask on, and I let you try my mask on. That's how you can pick up COVID-19. I'm sick, I'm in school, and I need to borrow a pencil to take my math test. So after I complete the test, I drop the pencil back off on your desk. You pick up the pencil, and then the bell rings, and you're thinking about something else, and you put that pencil in your mouth, and you're chewing on it. That's how you pick up COVID-19. Or you don't pick it back up, but the next student comes in and needs a pencil, and you hand it to them. And now they're using that pencil, and they rub their eyes, their nose, or their mouth, and now they get COVID-19. I'm sick. It's the first day of school. I've got to take a picture of this moment with my friends. I take a pic. It's a great pic. Everybody wants to see the pic, so I'm telling them I'm going to send it to you, but instead my friend grabs my phone and says, let me see it. And now she just got potentially infected because my hands are infectious because I've touched my eyes, nose, and mouth, and now she did the same thing. So now if she goes and she eats French fries or an apple or something, she can infect herself. I'm sick, I go to school, my best friend comes up behind me and she covers my eyes and my nose and she says, you're never gonna guess who's behind you, and she's touching my nose. Little does she know that my nose has been dripping because I've had allergies. I didn't really know I had COVID, and now she goes and eats something with her bare hands and she gets sick. I'm sick, I go to work, I forget my cell phone on the table, and my coworker's kind enough to hand it to me. But then my coworker puts lip balm on with their finger. They get sick. I'm sick, I go to work, I go pick up lunch for everybody, I hand them the bag of food when I come back, and they open up the bag and then they eat the egg roll with their bare hands without washing their hands first. I'm sick. This one's an interesting one. So I'm actually working at a drive-through restaurant, and I'm covering my cough, but I'm wearing my gloves the way the restaurant owners told me to wear my gloves, but I'm covering my cough, and you're coming through the drive-through, but you don't know that I'm coughing. So when you get there, I open the window, I take your credit card with this dirty hand that I just covered my mouth with, I put the credit card in the machine, and I hand you back your credit card, which is fine. You still don't have COVID-19. You put your credit card away, and then I hand you the bag. The French fries smell really good, and so you put your hand in there, and now you eat some French fries. Now you could potentially have picked up COVID-19. So these are all examples of how COVID-19 can be easily spread. These examples are given to you so that you can avoid these types of interactions. Assume everyone has COVID-19, especially as we go into flu season. Flu season begins in October, and everyone 6 months of age and older should get vaccinated against the flu. We know more about this COVID-19 virus than we did 6 months ago. Let's all go into flu season educated and protected. Wear a proper mask. That is so very important, and wear it properly. If you have a mask, please test it to see if you are able to blow out a candle while wearing your mask. If you are, the mask is not doing its job. If you cannot, then it should protect you during this flu season. I have 2 masks that I will demonstrate with. I'm going to use this mask. So just to kind of give you an idea, this mask actually looks a little flimsy, but I like it because it's easy to talk in, it's easy to communicate. And I actually don't feel like I'm suffocating with it. So I turn on the candle, and then I do the blow test. Take a deep breath. Again. Okay, so possibly this is not the best mask to wear because you can blow out the candle. So let's do it again with the other go-to mask that I like to wear. I'm not doing the N95 mask because those are really for the hospitals to use. They're really not for the public. So I'm going to show you with this other mask. This other mask has a filter inside it. But I still feel like I can breathe with it. It has a filter, so. There's actually no blowing out that mask with this because it's got the filter. And so just so you know, it's better to wear a mask that has a filter inside it that actually can give you the protection that you need this flu season. So I hope everybody does the blow test to check their mask and wears a mask that's thick enough to protect the persons around you, but also yourself from picking up any respiratory droplets. So stay healthy, stay determined, and as always, stay informed. Thank you.
En las últimas 24 horas se han reportado 69 casos confirmados por el coronavirus, lo que es buena noticia ya que no hemos reportado triples dígitos, ahora solo estamos en dobles dígitos. Esperamos pronto solo reportemos un dígito por casos positivos. 12,175 pacientes se han recuperado por completo, 143 personas continúan en el hospital, 64 están en la unidad de cuidados intensivos, 6,454 son casos aún activos. El día de hoy se reportan 10 fallecimientos, a la fecha los fallecimientos totalizan 363 personas. El promedio en los últimos 7 días ha bajado a los 67 casos por semana. Desafortunadamente, seguimos informando muertes diarias relacionadas al coronavirus. El día de hoy se reportan 10 muertes, por lo que enviamos nuestras más sinceras condolencias a las familias y amigos de los fallecidos. El día de hoy se llevó a cabo la toma de especímenes. Fueron 17 personas y 7 resultaron positivos, haciendo así una tasa del 41%. Le queremos compartir varios ejemplos de cómo se puede transmitir el coronavirus. Una persona enferma tose sin el cubrebocas, saluda de mano a otra quien se frota los ojos, la nariz o la boca o simplemente se muerde las uñas. Una persona enferma que no cuenta con un cubrebocas ajustado tose frente a otra quien está cerca. Una persona enferma tose, mueve su cabeza y otra que está cerca no cuenta con su nariz cubierta con cubrebocas. Una persona enferma utiliza un bolígrafo en el banco, otra persona usa ese bolígrafo después de él y al llegar a su carro se quita el cubrebocas tocándose la nariz. Una persona enferma va a la escuela y comparte su bebida con otra. Lo mismo sucede con una bolsa de papas. Una persona enferma pide un cubrebocas prestado solo porque le gustó y lo regresa infectado. Una persona enferma en la escuela pide un lápiz prestado para un examen, cuando termina lo regresa y esa persona se lo lleva a la boca. Una persona enferma en el colegio usa su teléfono para tomar la foto del primer día de clases. Los demás quieren ver la foto tocando el teléfono infectado y posteriormente llevan sus manos a la nariz, ojos o boca. Una persona enferma va al colegio, un amigo por detrás le tapa los ojos, luego esa persona come con sus manos sin lavarse las manos. Una persona enferma puede comprar comida para sus compañeros de trabajo. Tomas la bolsa donde está la comida y comes sin lavarte las manos. Una persona enferma va a trabajar, toca las puertas con las manos infectadas. Otros compañeros de trabajo usan la misma puerta, luego se llevan las manos sucias a la cara. Una persona enferma puede trabajar en una ventanilla de un restaurante. Tose cubriéndose la boca con guantes. Luego toma la tarjeta de crédito del cliente y al regresarla esa tarjeta ya está infectada. El cliente lleva sus manos a la bolsa de comida y empieza a comer de la bolsa con las manos sucias. Estos son solo unos ejemplos usuales para contraer el virus, por lo que es importante asumir que todos están enfermos y así tomar sus precauciones de salud cada vez que sale. Usar un cubrebocas ajustado es importante y puede probarlo teniendo una vela frente a usted. Si sopla y apaga la vela, entonces el cubrebocas no lo va a proteger, como lo demostró la directora Annette Rodríguez. Ahora el equipo de Texas A&M, de investigación de Texas A&M, nos va a entregar su reporte.
Good evening, everybody. My name is Dr. Chris Bird. I'm here to share with you the weekly report from the COVID task force. I was asked to make this shorter today, so we're going to try to cut down the amount of content and just focus on the important parts. So the task force has two objectives. It's to address the public concerns and questions about COVID-19 and the interventions that are taking place to slow down the spread of COVID, as well as enable evidence-based decision-making so that we can be sure that we are doing the right things moving forward to control COVID. There are several interventions that are in place presently. One is stay at home if you can. Two is to social distance, at least 6 feet. But in the past month, there have been scientific papers that have been published that indicate that 6 feet is probably not enough due to the aerosolized transmission of COVID-19, and you should stay farther apart. 6 feet rule is somewhere around 80 years old and was kind of a rule of thumb, and it works for particles expelled from your mouth that are visible. But particles expelled from your mouth and nose that are invisible can spread farther than 6 feet. We're also wearing face coverings, as Annette Rodriguez just demonstrated very impressively with the candle blowout test. Self-isolate when you're symptomatic and self-isolate when you've been exposed to somebody else that's symptomatic. Not unlike I'm doing. The last time, so I've contracted COVID. The last time I was symptomatic was Saturday, so I'm continuing to quarantine, and that's why I'm not there today. My symptoms were mild. I seem to be doing fine, so nobody needs to really worry about me. The way that I got COVID was probably one of those ways that the public health director just went over. There's only 3 options for where I may have gotten it from. It's either from there at City Hall giving this presentation, 2 at the doctor's office when I got a flu shot, or 3 at TAMU CC where I work. I went inside of a building for 10 minutes. Those are the only possibilities where I got it, and COVID was still able to get through. Now, some people might be discouraged by that. I know I was kind of discouraged, but at the same time, imagine how fast I would have gotten COVID if I wasn't doing all those things. And the same thing for everybody else out there. It's totally worth it to do all these things to avoid getting COVID. And we don't know, we can't predict who are going to be the people that have really negative effects and who the people are that won't. We're back to remote schooling, and you're going to see, interestingly, it seems to be having a positive effect potentially on the transmission of COVID. And we've gone through a few stages of opening Texas and then repealing them. And then we've been holding steady since the first week of July with the same level of restrictions. And under that regime, we've been able to get this outbreak sort of under control and are working towards getting back to reasonable numbers of new cases. But we're still, way above where we want to be. So in terms of transmission rate, we continue to oscillate between somewhere just below 1 and somewhere just above 1, depending upon the day of the week. On the weekends, there's a little bit more activity going on, so it looks like the transmission rate goes above 1. On weekdays, we don't interact as much and the transmission rate goes below. The way that we're able to get this level of detail is from cell phone data combined with an epidemiological model. And these 2 estimates of transmission rate are coming from 2 different models, one that uses cell phones and one that doesn't. When you look at this map of Texas, it's telling you the probability that the transmission rate is above or below 1. The reason why this value of 1 is so important is that when transmission rate goes above 1, then COVID spreads. When it goes below 1, it contracts. So blue is good and red is bad, and you can see, and white is somewhere in between, kind of a 50-50 proposition. You can see that we're trending at least in the right direction. If you look at these week over week, more of this map is blue this week than I recall from last week, and there's a very small portion of it that's red. Even then, most of the state is in this kind of right around a transmission rate of 1 or just below. In terms of our ranking here in the Coastal Bend versus the rest of Texas, and the number of new cases per day, we are at 4th or 5th place now. So that's going down in the rankings, and that's good. We want to be as low in this ranking as possible, hopefully down near the bottom. So our average new cases per day per 100,000 people is around 22 or 23, and that's a value that's continuing to decline. When we look at our total number of cases overall in the Coastal Bend area, that's represented here by these blue points, we're at 20,906 total cases, and these are COVID confirmed with the PCR test. The state indicates in their database that all the other counties and districts are reporting only confirmed cases, and so I've whittled the data set down to just confirmed cases for this report so we can compare to other locations in the state. With those 20,000, 21,000 cases, there's been over 16,000 recoveries, and the number of active cases, importantly, is headed downwards. So this is a positive development, and we hope that this trend continues. If you're wondering what the recoveries are going to do, they're essentially going to mirror the cases for the most part. So when the cases start to turn, then the recoveries will start to turn also. And you can see that that's been happening thus far. Importantly, I think this is something that we should consider. Here in the Coastal Bend area, we have more total cases than 12 other whole United States or states in the US. And it's not exactly where we want to be, and it just shows you exactly how bad that we had it compared to other parts of the US. Only one of these 12 states has a population that's near the same size as the Coastal Bend. I think that's Wyoming, and all the other states have well more people. So it's not because there's more people in the Coastal Bend, it's because we've had more COVID. And again, this is a Texas-wide outbreak. It's not just relegated to the Coastal Bend, and it's not over. We still have thousands of active cases, and this could easily, if things change, take off again, and we don't want that to happen. When we zoom in on the Coastal Bend area to look at counties besides Nueces, we've already seen a review of Nueces given by the public health director. So we're going to look at the other 11 counties in the Coastal Bend. You can see that there's a couple counties that are staying sort of level or going up very recently in terms of new cases per day. Jim Wells, Clayburgh, Live Oak, and Duval are all trending somewhat upwards, whereas most of the rest of the counties are very low or trending downwards in the right direction. In terms of the amount of positive tests that we're getting back, there's only two sources where we can look at our positivity rate, where we know that we quantified all positive and negatives that are coming back. And those are from the local public health department and the mobile testing stations that are out there. So the percentage of tests that are coming back positive, and these are deduplicated, which means that people aren't counted twice here. Each person's only counted once. Every person who gets tested is counted. They're only counted once. They are coming back with 40% of the tests being positive, and 21% of the mobile testing station tests are coming back positive. And there is a slight increasing trend recently, so that's not good news. And hopefully that's due to something more like the people who are choosing to get tested as opposed to some sort of developing trend. Now, the reason why there's such a big difference in the percentage of tests coming back positive is that these lines, they're not just lines and points. there's people underneath this, and these people, they have different characteristics. The people that are getting tested by the local public health department, they have symptoms. Like myself, I got tested by the local public health department. I'm one of these statistics now, and I had symptoms, so they tested me. But if you don't have symptoms, they won't test you. But the mobile testing stations will. And so I think that's probably a big contributor to why we see such a big difference in the percentage of positives, regardless of which one that you want to believe more. I mean, they're both true percent positives. They were both much, much lower back at the beginning of this present outbreak than they are now. And so we want to see these continue to trend downwards as opposed to stay these really high percentages. Moving on to hospitalizations, Coastal Bend is presently ranked 4th in terms of the number of people in the hospital on average over the past 7 days per capita. And it's right around 35 people in the hospital per 100,000. There's 600,000 people in the Coastal Bend. So I think you can do the math on that. And we'll tell you how many people are in the hospital in the Coastal Bend right here. There are 163 people presently hospitalized due to COVID-19 in the Coastal Bend area. Now, this number is different than the one that the public health director told us about because she's just reporting for Nueces County. This number, 163, accounts for all of the counties in the Coastal Bend area. What you can see is our model that's projecting the number of hospitalizations moving forward, or the number of people in the hospital. And right now, this is a good trend where it's over predicting. So we've seen a really steep decline in the last week compared to expectation. And we hope that this trend continues and that we'll have to update the model to have it project better what we expect to happen. But right now, this decline is well within the bounds of what might be expected due to random variation. And you can look back through time and see times where we go below or above the line with the true number of people in the hospital versus the predicted. So we're going to keep an eye on this. The thing that the part of the hospital where it was really stressed was the ICU, the intensive care unit. And you can look back here before the outbreak where there's a little bit less than 150 people on average in the ICU on any one day. And as the outbreak developed, we went way up above that amount, and nurses had to be bussed in from outside to help deal with the surge. And even today, you can see that there's a large number, 62 people in the ICUs at the Coastal Bend have COVID, and only 107 don't have COVID, where normally we're almost at 150 people that don't have COVID. So one way to interpret that is that we're about 30 to 40. There's about 30 to 40 people that normally would be getting that extra treatment that you get in intensive care that aren't right now, with a total of 169 people in the ICU in the Coastal Bend area, with or without COVID. Overall, the trend is going down. We hope that this trend continues, and we believe that it will. If we hold steady with the current interventions that are in place and our vigilance. Okay, fatalities, we're not faring quite as well. Fatalities, we're 3rd ranked right now, and we want to be last ranked. I want to remind you. So somewhere just below 0.5 fatalities per day per 100,000 people, which is just below 3 fatalities per day on average for the whole Coastal Bend. This is much more than we want to have. I know that a number like 0.4, 0.5 doesn't seem like a lot, but these are people. This dot says that there's about 3 people dying every single day from COVID-19 in the Coastal Bend area right now. Now, this is lower than it has been in the past, and that's good that we're moving in the right direction, but it's still unacceptably high. This week, I'm just going with the state's new method of counting fatalities, which at this point, it's no longer new. We've been doing it for well over a month at this point. So the way that it works is the state receives all of the death certificates, and if the primary cause of death was COVID, then that person is counted as a COVID fatality. So that's what these points represent. are the fatalities from the death certificate with the date. Give the date here of a fatality is the date on the death certificate, and the primary cause of death is COVID-19. Right now, we're at 463 fatalities using this very restrictive method of counting up the fatalities. It doesn't include people that died from other complications associated with COVID. Maybe COVID made something worse, so as a secondary cause of death, that's not even counted here. And we have 463 coastal bend fatalities. That's more than 15 states in the United States. And as I said earlier, only one of these states has the equivalent number of people as the coastal bend. All the rest of these states have more people. So we're faring worse than other locations in the US, well then a lot of other locations. And we want to continue trying to curb the COVID outbreak and bend the curve, flatten it, and stop these fatalities and get back to the point where it was a rare occurrence to have a fatality on any one day. This is our model projecting the number of fatalities out into the future. It is driven by cell phone data as well as epidemiological parameters of the outbreak. The circles represent counts of fatalities that we feel like they're not really going to change. It's they're more than 14 days ago, and we think all the death certificates have most likely been counted. The triangles represent the number of fatalities where we think that the numbers could still increase, and not all the death certificates have been counted yet. And this blue line is estimating where we expect these data points to rise to once all the fatalities are counted. Hopefully, what we see is something more like the lower edge of our confidence bound here than our most likely prediction or the upper edge. This upper edge would really only happen if there was a major change in our behavior, which doesn't seem to be happening. Okay, moving forward with the cell phone data. The cell phone data gives us a little bit of a look forward. Now, the things that are happening that I'm reporting today, they happened, those infections happened at least 2 weeks ago. For the fatalities, those infections happened maybe a month ago or more. And so the cell phone data can give us a look forward in terms of what's happening based upon foot traffic, where the cell phone's going, leaving home, which I won't be showing today, but it's been about the same amount as it has been for the past several weeks, and potential encounters where cell phones come close together to each other. And we've had a very positive development since the last update of the cell phone data, where the number of encounters occurring and the scaled relative to normal has declined. Last time I showed this, that wasn't the trend. We got about a week and a half more data since then, and there's been a steady decline. Now, you might be asking yourself what changed, the same way that I asked myself, what's changed over the past couple weeks? And the one thing that I could come up with is that remote schooling started. And so one possible explanation, at least for the weekdays and this decline in the amount of encounters, could be because kids are doing remote schooling, so they're staying at home, and their parents are maybe staying at home more than they would otherwise. That's a hypothesis. We don't have conclusive proof that that's what's happening, but we suspect that might be an explanation. Feel free to post on Facebook Live if you have other ideas, and we'll be sure to pour over all of them for why this is going down, but it's good that that's going down. It means that the transmission rate will probably also go down. In terms of foot traffic at the schools, which is something that we've been tracking, at the pro and tech schools, we've seen a little bit of an increase recently. At the universities, we've seen the greatest increase. I think we all know that universities have started back up with partial face-to-face lectures and labs occurring, although I, for one, am teaching my class online, and there's a lot of classes that normally would be face-to-face that are online, and there's a lot of measures being taken. The universities included here are TAMU-CC, TAMU-K in Kingsville, and UTMSI out in Aransas. K through 12 has kind of been level over the past week, and the junior colleges, which includes Del Mar, have been increasing very slightly. So we're going to keep an eye on this moving forward, but right now, not a huge amount of activity. We're well below normal, which is up here at this 100 line. So in summary, the Texas-wide outbreak is not over. While things are looking up, I'll mirror the statement of the mayor in that we want to continue to be vigilant and hope to keep ourselves heading in the same direction that we've been going. COVID-19 cases are declining in the coastal bend. COVID-19 ICU usage and fatalities are declining. Despite that, the number of fatalities is still unacceptable and the ICU is still stretched, even though we've been declining for a fair amount of time now. The return to remote schooling seems to be correlated with a decline in cell phone encounters, and that could in turn be correlated with a decline in the transmission rate of COVID-19. We'll see if that bears out in the data moving forward. And right now we estimate that the transmission rate, again, is somewhere between 0.9 and 1.1. What that means is that on average, each person that gets COVID is transmitting COVID to about one more person. Because we've been declining, really each person is transmitting COVID to slightly less than one more person, and we want to keep it like that. We need to continue our efforts to reduce transmission, just like the public health director reviewed, and it's not time to relax our precautions right now. There's over 4,000 active cases of COVID out there in the coastal bend, and those are the ones that are recorded. The CDC estimates that there could be 2 to 20 times more active cases than the ones that are actually documented, and that's something that we want to keep in mind. With that, we'll go to the translation.
El doctor Chris Berg continúa dando su reporte de manera remota debido a que aún continúa recuperándose del virus. Las últimas estadísticas indican que el radio de transmisión continúa en alrededor de una persona. Esta información está basada en datos de 2 fuentes, teléfonos celulares y otras por reportes de salud, lo que significa que una persona tiene la potencialidad de enfermar a otra persona. En el estado, el área de la costa se encuentra en el 5º lugar por números de casos positivos y continúan disminuyendo los casos activos, lo que es buena noticia. En cuanto a hospitalizaciones, el área de la costa se encuentra en 4º lugar a nivel estatal. Recuerde, el área de la costa consta de 12 condados. Las unidades de cuidados intensivos continúan reportando niveles mayores a la normalidad. En cuanto al número de fallecimientos en el área de la costa, se encuentra en el 3er lugar a nivel estatal, totalizando 463 personas. Esta cifra está basada en los reportes provistos por el Estado, donde ya se ha emitido un acta de defunción. El número de encuentros entre personas está basado en el movimiento y ubicación de los teléfonos celulares, también ha disminuido. Una teoría es el comienzo de clases, ya que los estudiantes deben permanecer en sus hogares para tomar esas clases.
Okay, thank you very much for that. I see that we have 3 questions today, and a couple of them might be for the public health director. I see that she went up to the microphone.
Okay, so we're going to go ahead and open it up for questions from Facebook, and then we'll open it up for questions if anybody has any at this time.
Okay. Annette, this question is probably for you. Do we know if hospitals are using RFL 100 as a treatment?
If they're using what?
RFL 100 as a treatment?
I don't know that. I can find out, but I don't know that at this moment.
Okay. All right. The next one, what are the differences between the health department and mobile testing sites? And either one of y'all or both of y'all can answer that if you'd like.
Well, I think I can start with the health district, and then Dr. Bird can also chime in as well. But for the health district, if you're symptomatic, if you're having shortness of breath or fever or cough or diarrhea or any of the COVID-19 symptoms, you can actually go through our drive-through. Some of the other drive-throughs, it doesn't matter if you're symptomatic or if you don't have symptoms, they will still take you through the drive-through. That's the biggest difference that I see.
Chris?
Right, and that matches exactly what we see in the percent positive rate, where we're more stringent in terms of who gets tested. Of people that are sick, 40% of them are testing positive. And of people, another group of people, some of which are sick and some of which aren't, those other people that aren't sick, maybe they just want to get tested. Maybe they encountered somebody who tested positive for COVID, so they want to get tested. That's where about 20% of those people are testing positive.
Okay. Last one, maybe a net question as well. What are the reasons we have such a high death rate? Is it prevalence of diabetes, health risk, or is it the hospital system, treatments, or something else?
You know, I think it's a combination. First of all, we know that people get sick first, so they get infected, and then they get sicker, and then they end up getting hospitalized in the ICU, and then some will go on to die. And so what we're seeing now is we're seeing that that peak was there July 17th, but you're still seeing the remnants from that peak. So you're still seeing people that are passing away. And yes, we do have a more vulnerable population. We have a high percentage of diabetics in our population, and we see that diabetics have a 3.5 times higher rate of being hospitalized if they become positive with COVID-19. So that is one of the indicators. Again, the older population, as well as people with other comorbidities that maybe other places don't have as many of. So it's a combination of all of those things put together.
Okay. That's all the questions from Facebook. Thank you.
Okay, so that concludes the presentation unless there's any questions from the audience? No? Well, thank you all for being here again. And we will be back on Thursday at 5 o'clock, and the mayor and the city manager and Judge Canales and myself and not Dr. Bird this time, not on Thursday, but we should all be here for Thursday's presentation. So thank you.